Dr. Pena, tell us about yourself and why did you go into medicine? What brought you into the medical field?
My name's Dr. Pena. I am born and raised here in Southern California. I grew up in Santa Clarita Valley over the hill, and my wife's family here in the Antelope Valley. I went into medicine primarily because, in my training in high school and college, I found out early on I really enjoyed the sciences. I loved learning about the human body and anatomy and physiology, and I wanted to put, my studies to use in the best manner possible to help just people in general. Originally, my studies were in physical therapy, and so I had an interest in doing things again more in the physical therapy or the sports medicine world. And so when I got to medical school, I found an interesting specialty of medicine known as physical medicine and rehabilitation, and that gave me the opportunity to not only study medicine but also to apply the undergraduate training I had in pre-physical therapy. And so coming out of training and being back here home has been wonderful to me. I've been here in the practice for about 7 years now, and I've had a chance to interact with my community and be a part of where I call home.
What is your profession?
So I'm a physician. My specialty of medicine is physical medicine and rehabilitation, and within my specialty of medicine, I practice a combination of, traditional rehabilitation medicine, but also pain management. So I consider myself a non-surgical musculoskeletal and neurologic specialist, treating patients with various conditions, impacting their function. So we as rehabilitation physicians emphasize form and function and return to function after injuries or during the management process of chronic illnesses. And so my specialty of medicine is one that can track a patient and help in terms of their progress from illness to independence.
What does a fellowship mean to you?
So fellowship training in the world of medicine refers to additional training after residency. Residency being the period of time after the end of medical school and until a physician comes out and is considered an attending. Fellowship training can be different in various specialties. In mine, in particular, in physical medicine and rehabilitation, there are physicians that will go and do fellowship training in pediatrics or in sports medicine, sometimes in pain management or even spinal cord injury care. These fellowships, again, allow that physician to take their training and subspecialize, basically taking another year or two even to learn more about a specific type of ailment within our specialty, and hopefully at the end of their training focus in on that in terms of their practice of medicine to be the subspecialist in that particular category.
What specialized training do you have or want the public to know?
Sure. So in terms of my specialty of medicine being physical medicine and rehabilitation, we learn something considered electrodiagnostic studies. Electrodiagnostic studies are a way to learn more about the nervous system and how it interacts with the musculoskeletal system. So within my specialty, that's very important information. And also for other specialties such as orthopedic surgery, hand surgery, neurology, so on and so forth. Electrodiagnostic studies are broken into nerve conduction studies and electromyography, or known as EMG. These two portions of electrodiagnostic studies are procedures that are meant to provide further diagnostic information and helping to identify why a patient might be having problems with numbness or tingling or pain in different extremities. And so that is something that within my training I have latched onto, and within the practice here at AVORS Medical Group, I provide these diagnostic studies for many of the providers, many of the physicians here in the practice to aid in further treatment for our patients. Another portion of my practice that I really enjoy providing to patient care is Botox injections. Botox injections in my specialty of medicine are indicated for migraine prevention and migraine treatment, and also for treatments of spasticity. Spasticity can occur in different regions of the body when there is increased tone or tightness to muscles, causing abnormal positioning of either the arm or the leg. This can oftentimes be seen after stroke or traumatic brain injury, or even after surgeries in the neck or lower back where muscle tension and increased tone are problematic. And so I provide treatment with Botox injections to my patients for managing these things as well.
Where do you practice? What location do you practice at?
So my practice is here in the Antelope Valley at our facility here at AVORS Medical Group off of 10th Street West near Avenue M. I also practice inpatient medicine, so hospital-based medicine for pain management and rehabilitation as well. I practice out of Antelope Valley Medical Center as well as Palmdale Regional Medical Center. In addition to those facilities, I also will see and treat patients within some of our local skilled nursing facilities in Lancaster.
What do you bring into this medical group?
So part of my offering in terms of this medical group as a physical medicine and rehabilitation specialist include things that we've discussed, such as electrodiagnostic medicine, as well as treatment for various musculoskeletal and neurologic conditions via pain management. Botox injections are a novel treatment as well for managing patients with chronic migraine disorder and spasticity. I'm also trained in performing interventional procedures for managing pain for patients. And so in the cervical spine or in the neck and the lumbar spine, the lower back, I perform procedures to assist with pain management. These include epidural steroid injections or medial branch blocks, also known as facet joint injections, or sacroiliac joint injections. These procedures are performed under X-ray guidance in a specialized surgery setting and can further aid in providing pain management to patients with both acute and chronic conditions.
What services do you offer?
Services that I offer in the world of pain management here for this office include injections to the lumbar spine and the cervical spine for managing pain. These include epidural steroid injections, facet joint injections, or medial branch blocks. I also provide treatment with Botox for patients with chronic migraine disorders and spasticity. Furthermore, electrodiagnostic studies are something that this practice uses to help in aiding the diagnosis and guiding the treatment for several patients with various conditions. And so these are the services I provide.
Do you specialize in anything?
My specialty of medicine is physical medicine and rehabilitation, also known as rehab medicine, or to some folks who've never heard the term, physiatry. So my specialty of medicine I like to describe to my patients as non-surgical care for patients with various musculoskeletal or neurologic conditions. My specialty of medicine also focuses on restoring function for people who have had either acute or are dealing with and managing chronic disorders of the musculoskeletal system and also the neurologic system of the body.
How long are your appointments? What might make you late?
So my appointment times vary depending on the types of procedures I'm performing in the office or the types of patients that I'm seeing. Follow-up appointments can vary from as many as 10 minutes to 30 minutes. New patient evaluations will oftentimes be in that 30-minute range as well. When procedures are performed in the office, such as Botox injections, where additional time will be needed to draw up the medication and mix it and identify the appropriate muscles to inject, these appointments can last a little longer, perhaps up to 45 minutes at a time. Things that might make me late to appointments can include complications with different procedures that are being performed, or some patients who otherwise might have additional questions aside from the usual follow-up questions, or oftentimes presenting themselves with a new injury or a new illness of some kind that would require further investigation. In these cases, obviously spending that time with the patient is important, but could lead to potentially being a little late with the follow-up appointments beyond that.
Tell us an interesting thing about your profession.
An interesting thing about my profession, particularly in physical medicine and rehabilitation, is that I have the opportunity to see patients both in the inpatient setting right immediately after their injuries to when they are transferred to acute rehabilitation, where the focus shifts from obviously stabilization and treatment of the occurring trauma or illness to rehabilitation in the sense of therapy. So I have the opportunity to see them in that setting as well, where they're performing physical and occupational and sometimes even speech therapy. They're improving slowly in a daily basis, where I get to observe them as well. And then oftentimes when they discharge home, we'll see them in the outpatient setting in the office. and continuing to assist in that transition from the hospital to the home setting. So that's one thing about physical medicine and rehabilitation that is unique and interesting, is the opportunity to see the whole spectrum of care from injury to independence, and being a part of that is special as well.
Why should one trust you with their care?
My training and expertise leading up to this stage of my career is one focused on functional recovery. I have within our practice the opportunity to see patients across a wide spectrum of care, from the hospital setting during the acute process to the office several years after injury in terms of chronic management. So having that full spectrum of care allows me to have different experiences with patients and provide assistance in terms of pain management and functional recovery, providing additional diagnostic information for other providers as well with regards to electrodiagnostics. And the amount of experience I've had within that branch of our medicine is important as well. This will be now 10 years and several thousands of EMGs I've performed to help assist and aid in diagnosis and treatment for our patient population.
How do you show patients you care for them and that they are not just another patient?
The most important thing when sitting and talking to patients is to make sure that they are heard, that they're felt. And so my attention, irregardless of how many patients are waiting for me, is always on that patient. I'm not ever looking at my watch. I'm not, considering the other, patients waiting for me. That person in front of me has my undivided attention for the appointment. So that's one way. An additional way is that during my procedures, specifically electrodiagnostics or EMGs, I take my time prior to the procedure to explain what will happen, to reassure the patient that it may be a bit uncomfortable of a procedure or an exam, but that at any point in time they have the ability to stop the procedure, to talk to me. I think spending a little bit of extra time at the beginning of our procedure does help to reassure people and to answer any questions, close out any doubts that they may have had that they did not want to proceed. Giving the patient undivided attention and an opportunity to speak and be heard is very, very important when it comes to providing care to patients.
Do you have a funny story to share about your career?
I can't think of anything off the top of my head. They're prepared ahead of time.
No, it's okay.
A funny story to share about my career.
Mm-hmm.
During my process of training in medical school and in residency, I moved around a lot. I went from California to Florida for my medical school training, 3,000 miles away from home, and to San Antonio for residency training, a little closer to them, about halfway back. During my training, I had the opportunity to work in 2 different hospitals where the majority of the patient population did not speak English and they spoke Spanish. And so a funny story would be along the lines of learning or relearning for me how to speak Spanish and how to communicate with my patients. One funny story is in the midst of taking care of a patient in the hospital, I wanted to express to them that because my Spanish was not the greatest, that I was only slightly embarrassed. Now the word embarrassed in English sounds a lot like in Spanish embarazado, but to be embarazado in Spanish means to be pregnant. And so when I told the patient that I was embarrassed at my Spanish speaking, I did use the word, try to translate it from English to Spanish, and said embarazado, and quickly realized as soon as it came out of my mouth that I just told my 63-year-old male patient that I was pregnant and not embarrassed. So that's got a good chuckle out of the staff that morning.
How would a patient describe your care?
I hope that a patient would describe my care as attentive, as providing good bedside manner, as thorough when it comes to diagnosing and identifying what the cause of pain might be, and hopefully also as wise in terms of understanding that diagnosis and how to apply the appropriate treatment.
What do you want the public and your patients to know about you as we wrap up?
I would like the public and my patients to know that I am 100% committed to being a physician and improving myself every day. Being a physician involves learning lifelong. Oftentimes during our training in medical school and residency, our staff and our attendings would let us know that we are lifelong learners. There's always something new to be learned, to seek out additional treatment plans and different techniques. And so what I would want the public and my patients to know is that I'm constantly in the literature, constantly looking for new and inventive ways to help wherever I can. And that, as I alluded to before, I'm fully committed to this practice and to this community and to the patients that I see on a daily basis.
What do you do for fun?
For fun, I enjoy playing different sports. I grew up playing soccer and baseball and a little bit of football. But my passion is soccer or football. I have 2 children that are involved in playing soccer as well. So I enjoy practicing with them and training them. I enjoy watching sports as well. My favorite team of all time would be the Los Angeles Dodgers. I have memories of holding my dad's hand as a very, very young kid and going to games as far back as the 80s. And so I enjoy watching the Dodgers play baseball. I enjoy playing soccer. These are all things that I'll do whenever I'm not working to have a little fun.